I'm Cathryn from the University of Southampton. Thank you for having a look at my poster. We have developed an intervention called CALM, which stands for Coping and Living Well with MND. And this poster takes you through the series of steps we used to develop this intervention using an approach called the person-based approach. So we started out by first conducting a qualitative study where we interviewed people with MND and their family members and asked them about the emotional issues they experienced and how they coped with any distress. As you can see on the screen, we identified 4 main triggers of emotional distress and 4 main strategies that people use to cope with any distress. For our intervention, this meant we needed to help people cope with any emotions that accompanied losing function or ability, help people cope with the anxiety about the future, and also focus on hope and positivity, and encourage people to be kinder to themselves when adjusting to various changes. We also conducted a systematic review of people's experiences of using psychological interventions. We learned that people valued a more personalized approach because everyone's coping styles and preferences were different, and that it was also important that interventions and components of the intervention did not seem effortful, especially when everyday living was already difficult. Based on these findings, the CALM website has sections on building positivity and meaning, adjusting to changes, dealing with worry and stress. And the techniques and suggestions we mainly used came from mindfulness-based approaches and compassion-focused therapy. So the 2 studies also informed how we designed the website. It had to be simple and easy to use, no fixed set of sessions so people could dip in and out whenever they feel like. It also had to be positive and empowering. And because people's coping styles and preferences were different, we offered both suggested techniques as well as practical tips for coping with difficult emotions. Our patient and public involvement members, whose photographs you can see on the screen, helped us refine our intervention further. If you would like any more information, my contact details are on the screen. Thank you so much for listening.